Hey, have you ever come across bronchial atresia? It's a really fascinating condition.
Bronchial atresia? Can't say I have. What's the deal with that?
Well, it's like a congenital anomaly where a segment of the bronchus gets blocked
Right.
off. But here's the kicker. The lung beyond that blockage still develops normally.
Wait, so the lung still functions even though the airway is cut off? How does that work?
Yeah, it's pretty wild. The air reaches the distal lung through tiny passages called pores of cone, allowing for collateral ventilation.
So the lung gets air, but what happens to the blocked bronchus?
It fills up with mucus, forming what's called a bronchoceal.
I see.
On imaging, it creates this characteristic look.
Interesting. Does it cause any symptoms?
Most of the time, people are asymptomatic. It's often discovered incidentally during imaging for something else.
Oh,
But
wow.
sometimes there can be cough or shortness of breath.
So it's like a hidden condition then.
Exactly. And on a chest x-ray, you'll see this tubular opacity near the hilum with overinflation of the lung beyond it.
Right.
On CT scans, it has that finger-in-glove appearance due to the mucus plug.
Finger in glove? That's a vivid description.
Haha,
Makes it easy to remember.
definitely. It's quite distinctive for bronchial atresia.
Got it.
Helps differentiate it from other conditions.
Speaking of other conditions, how do doctors tell it apart from things like congenital lobar overinflation?
Great question. The key is the combination of the mucus-filled bronchus and the hyperinflated lung segment. Other conditions might not show both features together.
But is treatment always necessary if it's asymptomatic?
Well, not always, but in about 20% of cases, there can be recurrent infections.
I see.
So sometimes surgical resection is considered.
Wait, surgery? Isn't that a bit extreme for something that might not cause problems?
You make a good point. The main reason is to rule out any potential malignancy that's mimicking the atresia. Plus,
Okay.
it can prevent future complications.
Makes sense. Do we know why bronchial atresia happens in the first place?
The exact cause isn't fully understood. Some think it might result from a small injury during fetal development. It's not necessarily a growth defect.
Interesting. And it usually affects the left upper lobe, right?
Yes, most commonly, the apico-posterior segment of the left upper lobe, but it can
Yeah.
occur in other lobes too.
It's amazing how the body adapts, keeping that lung segment functioning despite the blockage.
Absolutely. It's like the lung finds a workaround to keep going.
Exactly.
The collateral airways are pretty remarkable.
So to sum it up, bronchial atresia is usually an incidental finding, but important to recognize on imaging?
Definitely. Radiologists need to be aware of its features to avoid misdiagnosis.
Right.
Proper identification aids in appropriate management.
Well, thanks for shedding light on that. Learned something new today.
Happy to share. It's always exciting to dive into these unique conditions.